Hi everyone, my name is Yasmin, and originally I was going to give my speech on a different topic, but that all changed yesterday when my cousin came over for breakfast. She was telling me how she's been having a lot of pelvic and abdominal pain, breast tenderness, and just in case, she took 2 pregnancy tests. They both came back negative, and she said she'd be surprised if she was pregnant because she's been using an intrauterine device as her method of birth control for almost a year now. Then it clicked that I've actually heard this story before. My best friend actually went through the same thing not too long ago, but her pain and cramping got so bad that she actually ended up going to the hospital. I also have another friend from high school who had a different birth control method. She had the implant in her arm, and when she went to get it changed, they couldn't find it. Turns out somehow it had moved all the way down to her thigh. So it got me thinking, why do women have to bear the burden of contraception? Doesn't it make more sense to take the bullets out of a gun than to wear a bulletproof vest? One man can impregnate 9 women every day for 9 months. That's 2,430 pregnancies. But a woman can only get pregnant one time in those 9 months. Men are fertile at all times, whereas a woman's egg can only be fertilized during a limited time window once every month. Now, historically, medications have been tested on men during clinical trials or male animals, because women's menstrual cycles can be a complicating factor in those trials. So an effective birth control pill was developed for women along with other methods. Why not for men? A few years ago, I heard there was a birth control pill being worked on for men, but it was stopped during the trials because they started experiencing side effects such as depression, mood swings, and acne. Yet for women, there are far more side effects, not only including those, but also things such as weight gain, bleeding or spotting, elevated blood pressure, headaches, the list goes on. Contraceptive options for men are limited to condoms and vasectomies, yet condoms aren't always effective. They can break, they can come off, they can be damaged if you use the wrong lubricants, and they aren't always placed properly. And when it comes to vasectomies, only 9% of sexually active men in the United States get a vasectomy, and it's usually when they're middle-aged. So if you're in a heterosexual relationship, talk to your partner. How do they feel about the contraceptive method in your relationship? What if there were other options? Contact elected officials and request that they support measures to increase the funding for male contraceptive research. Make a donation to the Male Contraceptive Initiative. It's time for men to step up and share the responsibility. Support reproductive autonomy for all.